A very good evening to all of you. Today, in this series of Neet PG MCQ challenge, today the subject we are going to cover is obstetrics and gynecology. Obstetrics and gynecology is a very important subject as far as Neet PG or INICT is concerned. It carries a good chunk of 25 questions, means more than 100 marks in the Neet PG exam. And the questions are usually clinical case scenario based or sometimes the facts all except questions. So let us begin with the first question. In a young female of reproductive age with regular menstrual cycles of 28 days, ovulation occurs around 14th day of periods. When is the first polar body extruded? Young female, reproductive age, regular menstrual cycle, ovulation occurs on 14th day. When is the first polar body extruded? Let us look at the options. A. 24 hours prior to ovulation. B. Accompanied by ovulation. C. 48 hours after ovulation. D. At the time of fertilization. So, what do you think is the correct answer here? Young female, reproductive age, regular menstrual cycle of 28 days, ovulation occurs on 14th day. When is the first polar body extruded? So let us look at the correct option. The correct option here is B, accompanied by ovulation. Why? The first polar body is extruded accompanied by ovulation, while the second polar body is extruded after fertilization of the ovum by the sperm. Is it clear to you? If you are able to understand, write clear in the chat box. The first polar body is extruded accompanied by ovulation, while the second polar body is extruded after fertilization of ovum by the sperm. Please like, share, and subscribe my channel. Click the link in the description box to join the ultimate Neet PG masterclass blueprint, which will be a breakthrough for you. So let us move on to the next question. The finding of a single umbilical artery on examination of umbilical cord. You examine the umbilical cord after delivery and you see only a single umbilical artery. A. Is it insignificant? B. It occurs in 10% of newborns. C. An indicator of considerably increased incidence of major malformation. I think this is the correct answer. D. Equally common in newborn of diabetic and non-diabetic mothers. Now let us look what is the correct answer here. The correct answer here is C, an indicator of considerably increased incidence of malformation. Why? The absence of one umbilical artery occurs in 0.7 to 0.8% of all umbilical cords of singletons, 2.5% of all abortuses, and in approximately 5% of at least one twin. The incidence of single artery is significantly increased in newborns of diabetic mothers, and it occurs in white infants twice as often in newborns of black women. The incidence of major fetal malformation when only one artery is identified has been reported to be as high as 18%, and there is an increased risk of overall fetal mortality. So the correct answer here is an indicator of considerably increased incidence of major malformation of the fetus. So absence of umbilical artery in 0.7 to 0.8% of all umbilical cords of singletons, 5% of at least one twin, 2.5% of all abortuses. The incidence is significantly increased in newborns of diabetic mothers, and it occurs in white infants twice as often in newborns of black women. The incidence of major malformation when only one artery is identified has been reported to be as high as 18%, and there is increased incidence of overall fetal mortality. So the correct answer here is C. If you are able to understand this multiple choice question, then we will move forward. Write clear or C in the chat box. Please like, share, and subscribe my channel. Click the notification button so that you receive the live notification of this video. You can attend the live video and you can ask live the doubts in the comment box. Now let us move on to the next question. Which one of the following vaccination is absolutely contraindicated in pregnancy? A. Hepatitis B. B. Cholera. C. Rabies. And D. MMR. Now, what do you think? Which vaccines are contraindicated in pregnancy? Can anybody type in the chat box, please? What vaccines are contraindicated in pregnancy? Please click the link in the description to join the ultimate Neet PG breakthrough event. So the correct answer here is D. MMR. The vaccinations which contain live bacteria or viruses are contraindicated in pregnancy. Also, the administration of attenuated virus vaccines such as measles, mumps, poliomyelitis, rubella, yellow fever, and varicella are contraindicated during pregnancy. MMR is a live attenuated vaccine and hence it is contraindicated. So the correct option here is D. MMR. If you are okay with the option, please type yes in the chat box. Now let us move on to the next question. Please click in the link in the description box to join the ultimate Neet PG Breakthrough Blueprint Masterclass event of 2 days. It is absolutely free and you will get the support till the exam, Neet PG exam, if you join the group. Most common tumor to show metastasis to placenta is A. CA breast, B. CA lung, C. Melanoma, D. No tumor can metastasize to placenta. So what do you think is the correct answer here? Which tumor can metastasize to placenta? Usually metastasis to placenta does not occur. But let us look what is the correct option here. Well, melanoma is the correct option. Malignant tumors rarely metastasize to placenta. Of those that do, melanoma accounts nearly one-third of reported cases. Leukemia and lymphomas comprise another third. So the correct option among these options is melanoma. Please like, share, and subscribe this channel. Oxygenated blood from the placenta reaches the fetal heart in utero via A. Umbilical artery, B. Umbilical vein, C. Ductus venosus, D. Ductus arteriosus. The correct option here is appears to be ductus venosus. So correct option here is C. This ductus venosus is closest to the heart and it carries oxygenated blood and therefore the answer. So the correct option here is ductus venosus. The uterine blood flow at term is A. 50 ml per minute, again a factual question, B. 100 to 150 ml per minute, C. 350 to 375 ml per minute, and D. 500 to 750 ml per minute. So what do you think is the correct answer here? D. 500 to 750 ml per minute. The placenta serves as interface between the mother and fetus, allowing for the exchange of physiologically important substances which include oxygen, carbon dioxide, waste products of metabolism, drugs, etc. So the correct option here is D. 500 to 750 ml. If mother received lithium treatment for bipolar disorder during pregnancy, the fetus is likely to. Now, when the question comes up lithium, immediately the answer comes into your mind, abstain animally. Let us look at the options. A. Neural tube defect. B. Facial defects. C. Urogenital defects. D. Cardiac defect. Now let us look what is the correct answer here. Correct answer here is D. Lithium is a pregnancy category D drug. Lithium is known to cause various cardiac anomalies, especially Epstein anomaly. There is an increased risk of this anomaly in babies exposed to lithium during the teratogenic period as compared with the normal frequency of Epstein anomaly, which is about 1 in 20,000 births. So the correct option here is D, cardiac defect. Please like, share, and subscribe my channel. Share this video with your near and dear friends so that a lot of people are benefited. I will be conducting these live challenges every day on this channel, so please subscribe it. And you can click the link in the description box to join the class. I will also give my number where you can directly WhatsApp for any doubts. These now another 5 or 6 months are remaining, and in even if you have not prepared anything, if you attend these live classes on YouTube, at least 10 MCQs regularly you will do. 10 in 180 days, 1800 MCQs will be thorough for you. And out of those 1800, some 50 will come and your score will rise like anything. So please compulsorily attend these live classes. Lactational amenorrhea is due to A. Prolactin suppressing GnRH. B. Prolactin increases FSH and LH. C. Prolactin increases estrogen and progesterone. D. All of them. Correct answer here is A. Increased frequency, intensity, and duration of suckling are associated with high prolactin level. When the baby sucks, there is an intensity of suckling. It is associated with high prolactin level, prolonged ovarian suppression, and lactational amenorrhea. So the correct answer here is prolactin. Emergency contraceptive prevent pregnancy by all of the following mechanism except A. Delaying inhibition ovulation. B. Inhibiting fertilization. C. Preventing implantation of fertilizer. Interrupting an early pregnancy. So the correct option here is D. Well, this emergency contraceptive causes all A, B, and C, but it does not cause D. Emergency contraceptive is used to prevent pregnancy after an act of unprotected intercourse. It is an interceptive. Its main action is to make the endometrium unsuitable for implantation. It may also prevent or delay ovulation and prevent fertilization of egg by the sperm. It has, however, no role in interruption of early pregnancy once conceived. These are not abortifacients or contraceptives. So the correct answer here is D, interrupting an early pregnancy. Please subscribe my channel. IUCD having the longest lifespan is. This is a very important question. A. Progestasert. B. Copper T380A. C. Mirena. D. Novartis. Now we all know the half-life. This half-life is lifespan of T380 is about 10 years. So the correct option here is B. Copper T200, the life is 3 years. Copper T380A, 10 years. Multi-load copper 3250, 3 years. Multi-load 375, 5 years. LNG IUS, 5 years. Progestasert, 1 year. Novartis, 5 years. So the correct answer here is B. Thank you for watching this video. Please rewind it and watch it again and again until you master the things. These MCQs are very important. They have been taken from the chunk of the most important questions. It will help you improve your score. If you have any doubts, comment in the chat box, and you can click the link in the description box to jump into the WhatsApp group where you will get the 2-day masterclass ultimate Neet PG breakthrough blueprint revision masterclass. It will be very beneficial for you. Wishing you all the best. Thank you.